So I'm running a day behind again. But this recording is for February 26th, Wednesday, for the Final Frontier Npte prep course. Today our reading was on common skin disorders out of a Therapy Ed book, 2018, chapter 5, pages 271 to 275. So, I'm not crazy excited about this reading because it's not my favorite, but here we go. Dermatitis. It's an inflammation, causes itching, redness, skin lesions. The causes can be from allergic or contact dermatitis, poison ivy, harsh soaps, chemicals, adhesive tape, photosensitivity, reaction to sunlight, ultraviolet light, associated with allergic, hereditary, or psychological disorders. Stages is acute, red, oozing, crusting rash, extensive erosions, exudate. Subacute is scaling, scattered plaques. Chronic is thickened skin, increased skin marking, secondary to scratching, fibrotic papules, and nodules. Post-inflammatory pigmentation changes, and the course can be relapsing. Precautions or contraindications would be some physical therapy modalities and avoid use of alcohol. Medical management aimed at inflammation, topical or systemic therapy, corticosteroids, immunosuppressants, and antihistamines. Daily care includes hydration and lubrication of the skin. So, bacterial infections. Bacteria either through portals in the skin, abrasions, or puncture wounds. Bacteria enters through portals in the skin, abrasions, or puncture wounds. Impetigo. Superficial skin infection caused by staph or strep, associated with inflammation, small pus-filled vesicles, and itching. It is contagious, common with children and the elderly. Cellulitis. Suppurative inflammation of cellular or connective tissue in or close to the skin. Tends to be poorly defined and widespread. Strep or staph infection common, can be contagious. The skin is hot, red, and swollen. Management, antibiotics, elevation of the part, cool, wet dressings. If untreated, lymphitis, gangrene, abscess, and sepsis can occur. The elderly and individuals with diabetes, wounds, malnutrition, or on steroid therapy are at increased risk. Abscess. A cavity containing pus and surrounded by inflamed tissue. The result of a localized infection, commonly a staph infection. Healing typically facilitated by draining and incising the abscess. Viral infections. Herpes. Itching and soreness followed by vascular eruption of the skin on the face or mouth, a cold sore or fever blister. Herpes 2. Common cause of vascular genital eruption spread by sexual contact. In newborns may cause meningoencephalitis, may be fatal. herpes zoster, shingles, caused by varicella zoster virus, chickenpox, reactivation of virus lying dormant in cerebral ganglia or ganglia of posterior nerve roots, pain and tingling affecting spinal or cranial nerve dermatome, progresses to red papules, don't know how to say that word, along distribution of infected nerve, progressing to vesicles develop along a dermatome, usually accompanied by fever, chills, malaise, and gastrointestinal disturbances. Ocular complications with cranial nerve 3 involvement, eye pain, corneal damage, loss of vision with cranial nerve 10 involvement, post-herpetic neuralgic pain may be intermittent or constant, lasts weeks, occasionally intractable pain lasts months or years. Management: no curative agent, antiviral drugs, slow progression, symptomatic treatment for itching and pain, symptomatic corticosteroids. Contagious to individuals who have had not the chickenpox. Heat or ultrasound contraindicated. Can increase severity of symptoms. Warts: common benign infection of human papilloma viruses, HPVs. Interesting. Transmission through direct contact, inoculation is possible. Common warts on skin, especially hands and fingers. Plantar wart on pressure points of feet. Management: cryotherapy, acids, electrodesiccation, and over-the-counter medications. Fungal infections, ringworm. Fungal infection involving the hair, skin, and nails forms ring-shaped patches of vesicles or scales. Itchy. Transmission through direct contact, treated with topical or oral antifungal drugs. Athlete's foot. Fungal infections of foot, typically between the toes, causes redness, inflammation, pruritus, itching, and pain. Treated with antifungal creams, can progress to bacterial infection, cellulitis if untreated. Transmission: person to person or animal to person. Observe standard precautions. This is so boring. Parasitic infections caused by insect or animal contact, scabies, mites. Burrow into skin, causing inflammation, itching, and possible pruritus. Treated with scabicide. Lice. A parasite that can affect head, body, and genital area with bite marks, redness, and nits. Treatment with special shampoo or soap. Transmission: person to person or sexually transmitted. Avoid direct contact. Observe standard precautions. Immune disorders of the skin. Psoriasis. Chronic autoimmune disease of skin characterized by plaques covered with a silvery scale. Common on ears, scalp, knees, elbows, and genitalia. Common complaints: itching and pain from dry, cracked lesions. Variable course. Exacerbations and remissions are common. May be associated with psoriatic arthritis, joint pain, particularly in small distal joints. Etiology factors: hereditary, associated immune disorders, and certain drugs. Precipitating factors: trauma, infection, pregnancy, and endocrine changes, cold weather, smoking, anxiety, and stress. Management: no cure. Topical preparations: corticosteroids, occlusive ointments, coal tar. Immunosuppressive drugs: methotrexate. Physical therapy intervention: long wave ultraviolet light combination UV light with oral photosynthesizing drugs. Lupus: chronic, progressive, autoimmune inflammatory disorder of connective tissues. Characteristic red rash with raised red scaly plaques. Discoid lupus: affects only skin. Flare-ups to sun exposure. Lesions can resolve and cause atrophy, permanent scarring, hypopigmentation, or hyperpigmentation. Systemic lupus: chronic systemic inflammatory disorder affecting multiple organ systems, including skin, joints, kidneys, heart, nervous center, and mucous membranes. Can be fatal. Commonly affects young women. Symptoms can include fever, malaise, characteristic butterfly rash across bridge of nose, skin lesions, chronic fatigue, arthalgia, arthritis, skin rashes, photosensitivity, anemia, hair loss, and Raynaud syndrome. Management: no cure. Topical treatment of skin lesions: corticosteroid creams, indomethacin with fever and joint pain, immunosuppressive agents, cytotoxic agents with life-threatening disease. Observed for side effects of corticosteroids, which are edema, weight gain, acne, hypertension, bruising, propolis stretch marks. Long-term use of corticosteroids is associated with increased susceptibility to infection in immune-suppressed patient, osteoporosis, myopathy, tendon rupture, diabetes, gastric irritation, and low potassium. Systemic sclerosis, scleroderma, chronic autoimmune diffuse disease of connective tissue causing fibrosis of skin, joints, blood vessels, and internal organs, GI tract, lungs, heart, and kidneys. Usually accompanied with Raynaud's phenomenon. Skin is taut, firm, swollen, firmly bound to subcutaneous tissues. Limited systemic sclerosis, scleroderma, symmetrical skin involvement of distal extremities and face, slow progression of skin changes, late visceral and pulmonary hypertension involvement, associated with Crest syndrome. Calcinosis, Raynaud's phenomenon, esophageal dysfunction, sclerodactyly, and telangiectasis. Diffuse systemic sclerosis disease, scleroderma. Diffuse. So you have limited, and then you have diffuse. Symmetrical, widespread skin involvement of distal and proximal extremities, face, trunk. Rapid progression of skin changes with early appearance of visceral involvement. Important internal organs that are frequently involved include the kidneys, the heart, and the lungs. Management: no specific therapy. Supportive therapy can include corticosteroids, vasodilators, analgesics, immune suppressive agents. Physical therapy slows development of contracture and deformity. Precautions with sclerosed skin: sensitive to pressure. Acute hypertension may occur. stress, regular blood pressure checks, and vital sign monitoring. Pulmonary hypertension can lead to right-sided heart failure in severe cases. So boring. I'm trying not to fall asleep. Polymyositis, PM, a disease of connective tissue characterized by edema, inflammation, degeneration of the muscles. Dermatitis is associated with some forms. Sclerodactyly or interstitial lung disease are commonly associated with this disease, but they are non-specific to this disorder. Affects primarily proximal muscles, shoulder and pelvic girdles, neck, pharynx, and symmetrical distribution. Etiology unknown. Autoimmune reaction affecting muscle tissue with degeneration and regeneration, fiber atrophy, inflammatory infiltrates. Rapid severe onset may require ventilatory assistance, tube feeding. Cardiac involvement may be fatal. Management: medication, corticosteroids, and immunosuppressants. Precautions: additional muscle fiber damage with too much exercise. Contractures and pressure ulcers from inactivity. Prolonged bed rest. Physical therapy includes fatigue management and conservation of energy principles. Exercise, aerobic and resistance exercise at low levels are appropriate, provided fatigue and overload are avoided. See precautions. And positioning to prevent contractures and pressure ulcers. Skin cancer, benign tumors, keratosis, proliferation of basal cells leading to raised lesions. Typically multiple lesions on trunk of older individuals, untreated unless causing irritation, pain, can be removed with cryotherapy. Actinic keratosis, flat, round, or irregular lesions covered by dry scale on sun-exposed skin. Precancerous, can lead to squamous cell carcinoma. Common mole. Benign venous. Proliferation of melanocytes. Round, oval shape, sharply defined borders. Uniform color, less than 6 millimeters, flat or raised. Can change into melanoma. Signs include new swelling, redness, scaling, oozing, or bleeding. Malignant tumors. Basal cell carcinoma, slow-growing epithelial basal cell tumor, characterized by raised patch with ivory appearance or as a reddened area of ischemia. Has rolled borders with indented center or presents as a thickened area of skin. Rarely metastasizes, common on face in fair-skinned individuals. Associated primarily with prolonged sun exposure, although can occur in non-sun exposed areas. Squamous cell carcinoma has poorly defined margins, presents as a flat red area, ulcer or nodule. Grows more quickly. Common on sun-exposed areas, face, neck, back of hand. Can be confined or invasive to surrounding tissues. Much higher risk than basal cell carcinoma to metastasize. Mucosal and linguinal squamous cell carcinoma are often related to alcohol and tobacco use. Merojolin's ulcer is an uncommon form of squamous cell carcinoma that occurs in burns. Malignant melanoma. Tumor arising from melanoma sites, cells that produce melanin. Superficial spreading melanoma, most common type. Clinical manifestations of melanoma, see Table 5.2. Melanoma risk factors. Family history, intense year-round sun exposure, fair skin, and freckles. Nevi that are changing or atypical, especially if younger than 50. Lesions may have swelling or redness beyond the border, oozing or bleeding, or sensations of itching, burning, or pain. Red flags. Early detection requires skill and expertise. Since melanomas may look identical to a harmless mole, suspicious lesions are referred immediately to the dermatologist for further evaluation and biopsy. Treatment includes surgical resection. Prognosis depends on early diagnosis and extent of invasion. Table 5.2, clinical examination of malignant melanomas, ABCDEs. Asymmetry, uneven edges, lopsided. Border, irregular, poorly defined edges, notching. Color, variations, especially mixtures of black, blue, and red. Diameter, larger than 6 millimeters. Elevation or evolving, usually elevated but maybe flat. Moles have changed over time. Moles that have changed over time. Kaposi's sarcoma. Lesions of endothelial cell origin due to human herpes virus 8 with red or dark purple-blue macules that progress to nodules or ulcers associated with itching and pain. Common on lower extremities, may involve internal structures producing lymphatic obstruction. Increased incidence in individuals of Central European descent and with AIDS-associated immunodeficiency. Skin trauma. This is so boring. Contusion. Injury in which skin is not broken. A bruise. You have got yourself a contusion there, girl. Characterized by pain, swelling, and discoloration. Immediate application of cold may limit effects. I've got to get dramatic here because I'm about to fall asleep. Ecchymosis. Bluish discoloration of skin. The Smurfs had ecchymosis. Caused by extra blood into the subcutaneous tissues. The result of trauma to underlying blood vessels or fragile vessel walls. I cannot say that word. Pete-Shy. You know what? This is when you go to your Google and you get your Google to say the word. This lecture is full of words I don't know how to say. Does that make me a loser? No. Just makes me unable to say medical words, that's all. Okay, let's see what it says. Usually they have like a little thingy and you can hit it and it'll say the word for you. Let's see if that works. It's not working. Let's add pronunciation. Hey. See if that works.
Two young siblings, including one even feeling.
Nobody wants to have an ad. Just say the damn word. Okay, we're going to ask the dictionary. I have no idea how to say that word. Let's see what it says. Well, this is just taking way too much.
Petechiae.
Petechiae. Come on. Anyway, petechiae. I don't know where they get that. Petechiae. Wow. Petechiae. Tiny red or purple
Petechiae.
Petechiae, thank you. Hemorrhagic spots on the skin. Abrasion. Scraping away of skin due to injury or mechanical abrasions. Petechiae. Wow. Laceration. An irregular tear of the skin that produces a torn, jagged wound. Examination of integrity. Now this might be a little bit more interesting. Okay, let's get some ice. Okay, patient-client history. Complete history. Age, sex, race, social health habits, work, living, general health status, medical, surgical, full history. Current conditions, chief complaints. Functional status, activity level, medications, clinical tests, risk factor assessment. Techniques, observation, palpation, photographic assessment, and thermography. Pruritus, itching, common in diabetes, drug hypersensitivity, hyperthyroidism. We found another word we don't know how to say. Why is this blasted thing so slow? Let's see. URTICAR. Why is this not working? Slow. IA. Okay. I don't know why. Urticaria. Urticaria. Smooth, red, elevated patches of skin height, indicative of an allergic response to drugs or infection. Urticaria. 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 I think you have a urticaria from using that shampoo. Urticaria. Rash. Oh, I can say that word. Woohoo! Local redness or eruption on the skin, typically accompanied by itching. seen in inflammation, skin diseases, chronic alcoholism, vasomotor disturbances, pyrexia, medications, diaper rash, heat rash, drug rash. Xerodermia. My goodness. This is why I am not a medical doctor. Way too many words I don't know how to say. I think I would need a course just in learning how to say these words. R-O-T-E-R. Okay, let's see.
Xeroderma.
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 Xeroderma. Excessive dryness of skin with shedding of epithelium can indicate deficiency of thyroid function, diabetes. Okay. Edema. So what were we doing? Examination of skin. Okay. Now edema can indicate anemia, venous or lymphatic obstruction, inflammations, cardiac, circulatory, or renal decompensation. Determine activities and postures that aggravate or relieve edema. Palpation, volume, and girth measurements. Changes in nails, clubbing, thickened and rounded nail end with spongy proximal fold, indicative of Crohn's or cardiac cyanosis, lung cancer or chronic hypoxia, ulcerative colitis, binary psoriasis, neoplasm, and GI involvement. Present at birth is harmless. Oh, the window test. I don't know how to say that word either. Let's look it up. You want to? Why not? Sure. Okay. Well, it's not in the dictionary, so anyway, we'll just call it the window test. You want to? Yeah. Is often positive. Loss of diamond-shaped space when nails from opposite hands are placed back to back. Interesting. White spots seen with trauma to nails. Splinter hemorrhages. Small areas of bleeding under nails that look like splinters. Potential cardiac or renal signs. Changes in nails. There's another word that we don't know how to say. This dang lecture is just full of words that we don't know how to say. Why? Okay. How do you say it? Okay, forget it. Where are we? Often indicate systemic issues unless it is congenital. We're almost done with this blasted thing. 8. Changes in skin. Pigmentation, tissue mobility, skin turgor and texture. Skin turgor and texture. Wrinkling may be due to aging or prolonged immersion in water, dehydration. Blistering, stimmer sign. A thickened fold of skin at the base of the second toe or second finger that can be pinched or lifted. An early diagnostic indication of primary lymphedema. I want to go find a picture of that. That's interesting. We might actually even see that, so please hold. Okay, we found a couple of cool pictures of Stimmer's sign. A diagnostic sign for lymphedema, positive Stimmer's sign, is the inability to pinch a fold of skin at the base of the toes. This 37-year-old has primary lymphedema. Her Stimmer's is positive on the left foot, but negative on the right. Interesting. I love pictures. Changes in skin color. Cherry red. Palmar erythema could indicate liver or renal issues. And that's good to know. Cyanosis. Slightly bluish, grayish, slate-colored discoloration, indicative of lack of oxygen, hemoglobin, that indicate congestive heart failure, advanced lung disease, congenital heart disease, and venous obstruction. Examine lips, oral mucosa, tongue for blue color, central causes, or nails, feet, and hands, peripheral causes. Pallor, lack of color, paleness, can indicate anemia, internal hemorrhage, lack of exposure to sunlight. Temporary pallor seen with arterial insufficiency or syncope. Chills, shock, vasomotor instability, or nervousness. Yellow indicates jaundice, liver disease. Look for yellow color in sclera of eyes, lips, and skin. Orange yellow occurs with increased keratin intake. Look for orange yellow color of palms, soles, and face. Liver spots. Brownish yellow spots may be due to aging, uterine or liver malignancies, or pregnancy. Brown. Increased pigmentation, sometimes associated with venous insufficiency. Snip us a tool, you want to? Because a picture is worth 1,000 words. Right? Stop. Changes in skin temperature correlate with internal temperature unless skin is exposed to local heat or cold. Examine with backs of fingers for generalized warmth or coolness. Abnormal heat can indicate febrile condition. Hyperthyroidism, mental excitement, excessive salt intake. Abnormal cold can indicate poor circulation or obstruction, vasomotor spasm, venous or arterial thrombosis, hypothyroidism. So abnormal heat, hyper, abnormal cold, hypothyroidism. Examine temperature of reddened areas. Local warmth that may indicate inflammation or cellulitis. Hydrosis. Moist skin, hyperhidrosis, increased perspiration may indicate fevers, phlegmatic crisis, drugs, hot drinks, or exercise. Dry skin, hypohidrosis, can indicate dehydration, ichthyosis, or hypothyroidism. seen in later stages of diabetes. Cold sweats may indicate great fear, anxiety, depression, or disease. Changes in hair. Examine quality, texture, distribution, alopecia, hair loss, hypothyroidism, thinning hair, hyperthyroidism, sees silky hair. I don't know how to say that word. I don't know how. Let's see if we can find it. Let's see. HIRSUT. They need an easy way to pause this.
Hirsutism. 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 Hirsutism.
Male pattern hair growth, facial and body. In women may indicate polycystic ovary syndrome, Cushing's tumor, or an inherited trait. Last slide. Thank you, Jesus. Presence of lesions, unusual growth. Determine anatomical location and distribution, generalized or localized, exposed or non-exposed surface, symmetrical or asymmetrical. Type, flat spot, macule, small up to 1 centimeter, patch, 1 centimeter or greater. Palpable, elevated solid mass, palpable, small up to 1 centimeter, plaque, elevated 1 centimeter or larger, nodule, marble-like lesion, well, irregular localized skin edema, like hives, elevated lesions with fluid cavities, vesicle up to 1 centimeter, contains serous fluid, like a herpes simplex, Ebola or blister 1 centimeter or larger, contains serous fluid, 2nd degree burn. Pustule contains pus, like acne, and then color. So determine location, the type, and the color. And that is it for this. That was the most boring lecture ever. But at least next time I can listen to it instead of read it. That's it for, let's see, let's go to the top. That's it for Wednesday, 2/26/2020. Common Skin Disorders Therapy Ed 2018. Other systems, differential diagnosis.